All right. So Kwame Sarpong Asiedu and Thomas Cann join us. Kwame Sarpong Asiedu, of course, from CDD Ghana, and Thomas Cann is a journalist. He's also a renal patient. Good morning to you both.
Good morning, Kojo.
Good morning, Kojo.
It's great to have you both. We're going to get into the conversation now, but first, let's listen to a little bit of Richard Kojo Nyakon's piece on the dialysis crisis.
Last year, 15-year-old Priscilla Sante's young life was cut short. Her dream of becoming a nurse unfulfilled, leaving a void in the hearts of many. Her mother's voice joined the choruses across the country in calling on government to reduce the cost of dialysis in order for many to live. Priscilla was not the last to die. Many have died, and countless numbers are in the queue waiting to die because they can't afford to pay the cost of dialysis. 33-year-old Salas Mensah teary after hearing the announcement of the increase.
$490 for a day, so in that week, when it comes to it, costs you about 1,000.
He briskly calculates the amount of money he would now have to pay in order to live.
As for me, I don't have anybody. A guy saw me in Kumasi and then he told me to help me. If the price go high like this, I'm crying for the guy now.
It has been a very hard because of the money aspect of it.
Gabriel Mensah retired from the GES last year. Shortly after his retirement, he was diagnosed of the diseases. The weight of this announcement is evident in his voice.
Serious. We are going to die. We are going to die.
On YouTube, you can certainly watch it at any time. But let's talk about it right now. We have Kwame Sarpong Asiedu and Thomas Cann. Thomas, I want to start with you because this announcement, how exactly did you and other renal patients in Cape Coast, how did you take this announcement?
In fact, this came as a shock to all of us. It came as a very devastating news, and for us as patients here, especially for those of us who were advocating that the cost would be reduced, the other patients were like, is it that our leaders do not care or do not really understand all the noise and the pleas we were making? Did they understand our pleas to rather mean that they should increase it? So, Kojo, in fact, it's been a very devastating one. There was an incident, I remember, when that increment was announced. There was this old lady that I usually meet when I go for my dialysis session. She was there when the nurses announced that the cost was going to be increased. Just that moment when they announced the 491, this woman started shaking and shivering seriously. So it had to take her relatives who were around and one nurse to go and hold her. It is just, just hearing that the price has been increased alone was almost getting this woman collapse. So that tells you how devastating this increment news came to us.
For the benefit of our listeners, you are employed. You are the typical average Ghanaian employee. Tell us the effect of these payments that you have to make for your dialysis treatment just to stay alive. Tell us the effect that these payments have on your life.
So, when you are even employed, one would say that maybe you are lucky. But it's just fetching water into a basket. That is exactly what the situation is. So that tells you somebody who is not employed, how the person is feeling. And again, even if you are employed, it has to take the benevolence of friends and family to support you. Without that, I don't think you can survive it. And that is the life we are living. It has never been easy, if not for the benevolence of family and friends, classmates, and people you work with, and like people around you.
Yeah.
So I don't think I would have been alive speaking to you now. It's been very, very tough, Kujo. It's never an easy road at all.
Now, even if you could pay for every session, how is the access? How many machines are available? Are you able to just walk in, pay, get your treatment, and go home?
Kujo, that is the sad aspect of the whole conversation. You go to the hospital, you know, the whole dialysis process takes 4 hours. You go to the hospital, but because the machines are not enough. For instance, in Cape Coast Teaching Hospital, at the moment, you can say, oh, there are 5 machines functioning. But out of the 5, because I can tell you that 2 are not fully functioning. The only fully functioning machines are just 3. The other 2, somebody has to sit by the machine and every 30 seconds be pressing for it to function. So in effect, we only have about 3 machines that are fully functional. Wow. And as far as I know, Cape Coast Teaching Hospital has about a patient's relative of over 60.
60 so people on 3 machines.
60 patients sharing just about 4 or 3 machines. Look at the effect. For instance, if I go to the hospital now and in the queue, you come before me, it means that I'm going to spend 4 hours waiting and then 4 hours to wait for my turn. Then I also go on the machine for 4 hours. That is 8 hours. So imagine the mental torture and the emotional torture. The whole thing is like, because the machines are not even available, they are not even enough to provide the services. Everything about it is just mentally challenging.
Wow. Now, Thomas, how many times do you in particular, how many times do you get dialysis in a week with all these constraints?
Because doctors tell us we have to do 3 times a week. Now, because of the cost with the dialysis, medications, and other stuff, I usually do just twice a week.
Is that having an effect on your health? I ask this because, Thomas, I actually saw you yesterday.
Yes.
Right? And, I mean, look, I could see that, and I hope you don't mind me saying this, but I could see that your eyes were red and, you had lost some weight. Tell me, having to do it twice a week instead of 3 times a week, what effect is that having on your health?
Because it really does have that effect, because that is why the doctors know that it is ideal for me to have 3, because the kidneys are not functioning well, so I'm supposed to do 3 times a week, so that whatever toxins or whatever waste that's supposed to get out of my body can come out. But here is the case, because of course I'm just doing twice a week. So it's really having an effect on me. I just try to, kind of accept the situation and then try to live life like as if all is well with me. Sometimes I only have to psych myself and then just try to move on.
Yeah. Thomas, thank you. Stay with us. Kwame, I deliberately went through all of these things with Thomas because I felt like, our audience really need a clear picture of the reality of this thing. These numbers we're throwing around, this is what it means to an actual human. Kwame, government is well, they're trying something. The NHIA says they're going to throw some 2 million cedis at it while they try and figure out whether they can do more. Will this? I mean, is this going to solve any part of the problem?
Okay. Good morning to you, Kojo and Raymond, and to the listeners and Thomas as well. Kojo, I feel hurt. I do, because I mean we coming back to a conversation that was started with your thought leadership forum at Multimedia, that has had nothing happening. And I'm beginning to think our leaders, I am not just saying the government, our leaders, and I would explain. Our leaders are deceptive, and they are unwilling to solve our problems. I am not saying that they are unable or incapable for a reason. So now let me explain. A new CEO of the National Health Insurance Authority comes in. He thinks that, dialysis has become topical. And therefore, and the president and other members of the government had said that the NHIS should take over the payment of dialysis. So they go to Parliament as presenting their budget. And our parliamentarians say, okay, we've approved 2 million Ghana cedis. And I just listened to my friend Abuaji say that, well, yes, half a loaf is better than none. And I wholly agree. But let me do some mathematics with you, starting from the figures that Raymond gave you. The prevalence rate of dialysis in Ghana is 38.3 per 1 million. So when you do the maths, in a population of 33 million people, we have 1,264 people on dialysis. We know the number is about 1,300, but to be accurate, let's use 1264. So now 1264. The Ghana Health Service, the NHIS says, we're going to take 2 sessions per person per month. Hello?
Yes, we're listening.
Yeah, they are going to take 2 sessions per person per month.
Right.
So if you multiply 2 by 491 by 1264, and you multiply by 6 months, which is the number of months Dr. Abuaji Costa says they are going to pay for, that comes to 7.5 million Ghana cedis for the 6 months, just to provide that to the patients. And our parliament approves 2 million. So the first question I asked myself when I heard that approval is, are we saying that we don't have anyone who can do arithmetic on that committee? Are we just saying that our parliamentarians want to convince me that they couldn't do basic arithmetic like I've done now, to say that at least we need 7.5 million cedis just to make this work? So yes, Dr. Abuaji Costa has 2 million cedis, and that would be a good start. But we are still 5.5 million cedis short, just to provide them with the funds for 2 sessions out of the 8 they are supposed to do a month. Then, Kojo, this is the second part of the calculation. You know that our cedi is playing pound logo with the dollar and the pound.
Yep.
There is a reason why health expenditure per capita is always dollar indexed. It is because a lot of the consumables that go into provision of healthcare are imported into our country, and globally so. So to get a uniform baseline, you have your health expenditure per capita quoted in dollars. If you look at our budget, Kojo, at the time we quoted our health budget, the dollar was 11.3. Now I've just seen on your website that it's almost 15.2. So the dollar has lost about 25% of its, the cedi has lost about 25% of its value to the dollar.
Yeah.
Which then means our health expenditure per capita has gone down by 25%. Because we are not going to change the money we voted in our budget. Right?
That's right.
Are you still telling me that so the people in our parliament can do arithmetic? Then let me continue. We say we have 1,264 people on average on dialysis. If you do the calculation and you say that how much is it going to cost? It's going to cost them 51,064 cedis a year just to stay on dialysis. That is at the public sector rate. We are not talking about the private sector, because you do the private sector calculation and it's 109,000. But
this is
for
per
the government
person.
sector, it's
This is per person, right?
per person, yes.
Yeah.
So it's 50, because all you have to do, Kojo, is to multiply 2 by 491 times 1264 times 52 weeks in the year,
Yeah.
and you get it. And that's why I'm just trying to do the arithmetic so people appreciate. So then our parliament then says we are approving this for the needy. Our statistical service tells us that 80% of Ghanaians earn below 3,000. If you do 3,000 times 12, it's 36,000. So basically, every Ghanaian public service worker is needy, and you approve 2 million cedis for them. Kojo, are we smoking pot in this country? I am very upset today, Kojo. The more I do the mathematics, the more upset I get. Now let's continue. If you do this 51,064 cedis per person per year, if you want the NHIS to take it on, and you multiply that by 1,200 people, they need 75 million Ghana cedis per year. Meanwhile, through the wisdom of this government, they've cut the funding to the NHIS. So you are tying the hands of the chief executive and his board and his staff behind their back, and telling them to pick money that you've not put in their budget when the city has also depreciated. And you see, Kojo, this is why I say our leaders do not want to solve our problem. They are unwilling. They rather would say 2 million and noise, and everyone would make noise, because you know what? As Ghanaian citizens, we are also lazy. We wouldn't do the maths to say, where is this 2 million taking us? And even if the NHIS, if some politicians stood on a platform today and said the NHIS would absorb, what do you call it, dialysis, we wouldn't ask the question, why are you going to 575 billion plus from on top of our health budget? That, Kojo, if you look at that, I said 65.3. If you look at that, it is something like you're looking for another almost 5 million Ghana cedis, $5 million a year, just to pay for dialysis. And we cannot let these patients down this badly. And why am I sad today, Kojo? I am sad because I have been doing this math. If you remember the thought leadership, I did this, I broke it down from the private sector, public sector, I did the averages, and I remember Dr. Nsiasari going on and on and on, and me starting to laugh, because I was like, look, you people are showing a total lack of appreciation of the size of the problem. And you know what, Kojo? If it happens to anyone anywhere in the world, they don't pay. Because nowhere in the world can anyone fund dialysis from their pocket privately and want to stay alive after 2 years. It's a miracle if you can do it. I'm still looking for a country where people pay for dialysis out of their pockets. So the question you asked me, yes, I've tried to expand the question, but I want Ghanaians to understand that we need to have a much bigger conversation. Yes, I've said this before, and we did have the conversation. But this time, it shouldn't be a conversation where we get people to the table just to come and talk. We need to be actually doing the actual numbers. We need to then ask ourselves, where are we going to find this money from? You see, and that is why when I hear the ridiculousness that goes on, and then the vice president goes and someone says, oh, they've not paid Alawa, I'll let you pay tomorrow morning. We have real serious problems, Kojo, real serious problems. Problems that determine life and death. And I have said it somewhere, and I'll repeat it today. If I was in charge of our health system, I wouldn't take money to go and pay Alawa when I cannot keep majority of the citizens alive. I would be shirking my responsibility as a leader. Leaders take bold decisions, brave decisions, unpopular decisions. Leaders do not play to the gallery. And I'm not one who believes I'll ever play to the Ghana. So I'll leave it here at this point.
Kwame, look, obviously this is a money problem, and government does have money for other things. They are paying all kinds of. I mean, you're talking about having to raise some extra $5 million in order to pay for this thing for a year. They just paid $11 million to some contractor for, final payment for a project that hasn't even started. Government has money for things that they think are important. What can we do to make this government decide that this is important?
Kojo, that's why I said that the government knows that as Ghanaians we are lazy. And you know what I mean by we are lazy? You know what? I've put these numbers out, and that is why I've put them out so that everyone can pick a calculator and calculate along with me as we were going along. But you know what? We will turn ourselves into NDC and PP and fight on social media everywhere that the 2 million, half a loaf is better than that, and fight that the government cannot fund it. Yet we see the wastefulness of this government when it comes to priority. You're talking about the 11 million. What about the pit? Have you forgotten about the pit? That we raised buildings down. You see, Kojo, and that is why I am saying that we are our own worst enemies. But what we forget is my friend Thomas. I don't know his party affiliation. I know him as a journalist. I've met him at programs. We've discussed these things at length. I don't need to know whether he's NTC or MPP. I'm quite sure when he got renal dialysis, the first time when he had renal failure, the first time he went to a hospital, he was not asked the first question, what political party do you belong to? When our health committee was, our parliamentary committees were actually approving the numbers. And you know what, Kojo? I feel sorry for the hospitals. Before I continue, I feel sorry because at the time they asked for the increment, the dollar was 11.3.
Yeah.
The dollar is now 15.2. The consumable prices are still pegged at the dollar. So they've increased it. The patients are crying. The patients cannot pay because their salary hasn't gone up by 25%. But the hospitals cannot do anything because if they don't take even this minimum, they cannot operationalize their dialysis centers.
Yeah.
So you see, so then I come back to this whole governance system. We would know all these things. We know that the hospitals have their hands tied behind their back. We know the NHIS has its hands tied behind its back. We know the parliament we have didn't do the arithmetic. We know our government is wasteful and likes doing propaganda and unnecessary things that do not prioritize our health. But yet we would fight to justify why they do these things. Whether it's the NDC in power or the MPP in power, we will fight each other. So, Kojo, if you ask me what we can do, we need to start getting realistic. We need to look at these numbers. We need to find out that Thomas was never asked for his party card when he was diagnosed. When we get to that point and we start nailing the feet of our leaders to the floor to solve our problems, we would have solutions.
Let me bring in Thomas to wrap this up. Thomas, so now the price has been increased. Tell me honestly, how are you going to pay for your dialysis?
So, in fact, I'm happy with Kwame's submission. I have been on dialysis for 11 years, and it's just by the grace of God. It is very unfortunate that throughout all these years, and all the appeals that we've made to government, or should I say successive government, all the assurances and promises, we just received too much of rhetoric without getting any solution. Because it looks like the more we ask for a reduction in the cost of dialysis, it is as if though we rather ask or shout for an increment. Because you make the pleas, and the next thing is there's an increment. You ask, how am I going to fund it? And here is the case. And at this moment, if you would permit me, I would like to thank all those who have helped me. especially my schoolmates from Cann, Nova, over 2004. I say a very big thank you to them, especially our president, Asiedu. In fact, and my family members and the friends, they have been the backbone. In fact, Kojo, it is just like me coming to you for an assistance. For instance, if Kojo, you pay for one session for me, it is difficult always calling you that Kojo, today or tomorrow I'm going for dialysis again now. For you to keep helping me. It's never easy. So when there's an increment, it becomes more difficult. Because you know, you go in, somebody supports you. And even the person supporting you is always problematic. Then you wake up to an increment. It becomes more, mentally derailing. In fact, it's never an easy thing at all, Kojo.
So will you be able to afford it? That's what I'm asking.
Patients is that we're asking for.
Thomas, can you hear me?
Yes, Kojo.
What I really want to nail down is whether you will be able to afford it. You've been relying on the help of friends, but now the thing costs more. Will you be able to afford it?
Kojo, no. In fact, even with the cause that they said the NHI is going to take time, and they're saying that half a lot is better than allowance. But Kojo, that half we do appreciate, but again, it's so expensive for us. Kojo. Sometimes when I'm speaking like this, I even see other patients who are even worse than I am, especially those who come from the hinterland. There are other patients who come from villages beyond Chifopraso and those places. They have to, before even they get a car to get to Chifopraso, these are communities that vehicles hardly go there. So when they get one vehicle to move them to a junction that will even take them to Chifopraso, it will take about 5 hours. So that tells you how difficult the whole thing is. Like, so somebody coming from the village who is already struggling to even get a vehicle, to even get money to even pay for just the transport, and the person is able to raise some money to come to the hospital and then come to receive services. And it is the same way with how we lost Priscilla. They were coming from a village beyond Chifopraso. So, Kojo, it is something serious, and then we need solutions. And again, I wish that the government or the stakeholders involved will hear this and then know that enough of the rhetoric. We want real solutions to save lives. People are dying, Kojo. People are dying.
Yeah.
People are dying, Kojo.
Thank you, Thomas. Thank you so much. Kwame, remind us again, how many renal patients on dialysis do we estimate to be in Ghana?
Well, the estimate is 1264 based on our prevalence, but we know it's about 1,300 based on the data from the respective hospitals. And Kojo, we need. I think we should make health a campaign conversation. I keep saying this, but it's not about making it a campaign conversation about who built more hospitals or bought ambulances. Who has more robust policies and who has more strategies and who understands these things and is willing. We need to have powerful conversations. It's not about Alawa and someone got Alawa and someone. Those ones are cosmetic. And I don't even know why Ghanaians who are the receiving end of this poor decision making always cheer these things on. It just gets me. It really does, Kojo.
Yeah. Thank you both for your time. Kwame Sarpong Asiedu is a pharmacist, D&D fellow at CDD Ghana. Thomas Cann is a journalist. He's also a renal patient.
At the end of the day, somebody will struggle to get dialysis done today. They may either decide that I'm going home, I can't pay for it, I can't even travel to the center. And we pretend that all of this will go away merely because we, like we have done in times past, fix permanent problems with experimental issues. If this republic wanted to make sure that it has a robust system for dealing with renal failure, it could do so. We were able to raise 250 million to host games in this republic for like a month. And our kitty did not run dry. We borrowed money, we added some to it. We were able to revamp facilities that have been lying there for God knows how long, just to host games, so that we can look good to outsiders and pretend that all is well within this republic. But the primary duty of state, helping individuals survive so that they can continue to contribute, they can actually reach a certain age that they desire, retire, live a meaningful life. After that, then at some point we give them a dignified exit out of this world. That kind of role that we expect hardly happens because it is not priority. Sometimes we can't fail but say this. These things happen to some of us because you are not the ones in charge. And I've said it before. We started building a hospital that has been in a terrible state for a very long time because the minister's wife died there when giving birth. We agreed that we needed to fix ambulance problems in this country because there was an accident involving the minister, and we had to actually get the Air Force involved to actually go and airlift the person. Sometimes you just think that the only way issues are resolved is when the people you have elected to be in place are the ones who are the victims here. We are not ashamed that we take our Speaker of Parliament outside this country consistently for healthcare. We are not ashamed of that at all. We are fine. We actually mostly tout it. It's read openly that, oh, he's traveled for this and that, and all of that happens. The executive president is bold enough sometimes to tell us that, oh, he's going on this healthcare tour to this place, to that place, and sometimes even say it's routine. And yet, the systems we need to put in place in this country, and Kojo, social services, the good part is that even you, the protector today, you don't know when you will need it. You don't know when you will be on the Kumasi-Accra highway. You do not know when you would have no protection available to you and cannot be airlifted out of this country. That is why this is everybody's conversation. But most importantly, this week, if we do not save some lives, they will die. That is an important conversation that nobody can tell me there is something more important than that.
You see, Ray, I hate lies. Let's walk through this very quickly and carefully. It costs 491 cedis now to have one dialysis session. In order for a renal patient to stay healthy, he actually needs 12 dialysis sessions a month. That is 3 every week. But we can't even afford for them to be healthy. So just for them to stay alive but sick, they have to have 2 sessions a week. That is 8 sessions a month. 491 cedis per session. The NHIA says they are going to pay for 2 sessions per patient per month for 6 months. 2 sessions per month for 6 months. So that means they are going to pay for 12 sessions with 2 million Ghana cedis. There are about 1,300 renal patients in Ghana. If you take 2 million and you divide it between these 1,003 patients, each patient is going to end up, let me do the maths for you, 2 million divided by 1,300. Okay. Divided by 1,300. Each patient will get 1,538 cedis. That pays for 3 sessions in total. Not 12. 3. So in the very first month, after the third one has been paid for, in the first month, it starts on 1st of June, right?
Yeah.
So in June, after each renal patient has got their third treatment, so that means second week, first treatment. After that, the NHI money will run out. So why have they told us that they are going to pay for 2 sessions a month for 6 months? 2 sessions a month for 6 months. Why have they told us that? Why? Why are they lying to us? And I'm sorry, I'm being quite clear here, because what they have said they will do with the 2 million, it is impossible for them to do it. They talk about subsidy coming from somewhere for Kolebu people. That's Kolebu. That's Kolebu. But if you go to Interbeton in Cape Coast, who is giving them subsidy there? If you go to Konfanoche, who is giving them subsidy there? So, what do you mean? What do you mean? And why are we supposed to take this as a serious attempt to solve the problem? Why? Even the machines that will be delivering the care, we don't have. We don't have. Why are we pretending to solve the problem? And what Kwame said that really hit me was that if you go on social media right now, there will be some misguided person defending this. Defending this. Some person who has the undeserved privilege of both kidneys working will be using that this morning to defend this while people die. You heard of the old woman who, the moment she even heard about the price increase, started shaking like a leaf and needed instant medical care just to survive the shock of the announcement that the thing that she has been struggling to pay every time, suddenly it has been moved outside her reach. It's not like it's the hospital's fault. Even this increase will not cover the real cost. It will not. And last time, they had to shut down for several months because of 4 million cedis debt. Kolebu. They had to shut down because of 4 million. We are just creating another avenue for more debt for them to have to shut down again because we refuse to solve the actual problem. The actual problem. Meanwhile, we have millions to dig holes, to pay for no work done, to pay companies to come and do revenue assurance that doesn't assure any revenue. We have money to do all those things, but we can't save our own citizens' lives.